Correct knowledge is relieving and a pathway to the happiness. Hi everyone. In this clip, I am going to answer to this three question. What is heart murmur? Is it important really? And what should I do? Heart is a muscular pump that is inside of the chest, behind the torso bone or sternum, a little shift on the left side. That is the reason when we we want to point to the heart is on the little shift and tilting to the left side. The size of the heart in each person is almost generally is the size of the person fist. If we cut the heart, we can see four chambers inside of the heart. Each side, we have two sides or two heart in more detail. Left side, that responsible for pumping the blood to the all body oxygenated blood, and right side that pumping deoxygenated to the lung, and over there take the CO2 out and give O2 or oxygenated to the blood, and then go back to the left side, and this circulation repeat. At each side, between those two chambers, left atrium and left ventricle, there is a valve. On the right side, there is another valve. Left side, mitral valve, right side, tricuspid valve. And at the exit of each ventricle, that's connected to the big artery, aorta and pulmonary artery that go to the lung, there is another valve, aortic valve and pulmonary valve. Those valves are very strong. Actually, after the bone and tendon, they are strongest structure in the body. Even they are very thin, almost about 1 millimeter thick. But they are very flexible but strong. During heart activity, those valves open and close. The function of these valves is that directing the blood in one way, only forward. When the blood goes from the left atrium to the left ventricle, it open here, for example, mitral valve, and then when the heart want to pump, left ventricle pump, this valve closed and the other valve, the aortic valve, open. So always in normal situation, blood goes one way due to the function of these valves. Each of those valves has different shape. Generally, in those valves that are at the beginning of the big arteries, aorta and pulmonary, they are half cup shape. They called it cusp. They are three. And for the other two valves, mitral and tricuspid, they are like the flap that we called it leaflet. When those valves during cardiac activity open and close, they create a sound that especially we can hear those closing valve. And closing valve we can hear very easy with putting our ear on the chest on the left side of the person here, or with the medical instrument we call the stethoscope. We can hear those hard normal sound like this. That is a normal sound of the heart that we can hear. Now let's see how murmur create. Murmur is a sound that is created by passing very high speed of the blood through a narrow passage or orifice. We called it murmur because it creates a turbulence at that level, and this is we called it murmur. Murmur can happen in two situations. One of them is when the valve going closed, as you can see here. As the normal, as I mentioned, they are very soft but strong and flexible. When they close, they cover up and kissing each other and doesn't let bad blood goes backward. But in any situation that this function and closing and cover up is not perfect, some blood can go escape from that defect and go backward and create murmur or sound, extra sound. It's like the fishing. I will show you later how it looks like. So that is one of the reasons that we called it in this situation leaky valve, or medical term regurgitation valve or insufficiency. This type that at the top of the most common reason for leaky valve or murmur is mitral valve prolapse. It's very common in the society, and most of the time is trace or mild, a small amount of the blood, less than 10 milliliter, pass and escape and go backward, and it doesn't cause anything. But sometimes it progress and become severe, moderate to severe. In that case, it will become problematic and we need to do something that later I am going to talk about that. Or for any reason, aging, for example, during aging, this leaflet due to atherosclerosis, some degenerative changes, some bumping at that tip of those valve come out, and so they cannot cover up each other. A little of blood can escape from that defect and create murmur. Another condition that can create murmur is when the valve is thick and calcify and atherosclerosis. In other words, valve become tight. That in the slang word, usually they call I have tight valve, aortic valve or mitral valve. In tightening or narrowing valve, due to those atherosclerotic changes or other causes, those valves that should be teeny, flexible, and soft become tough, rough, and stick together, and the valve cannot open very well. So it becomes a narrow orifice or passage, and since the blood strongly passes through that narrow orifice, it creates a sound. And that we called it murmur. So we have two situations we can have murmur: leaky valve or tight valve. Another situation that usually is in the childhood neonate congenital is intracardiac shunt. That is between those two chambers. Normally there is not any direct communication. That in the neonate sometime we will see very common, especially in neonate, there is a small hole naturally in the fetus life. There is some hole there that should be closed after birth, but sometimes stay open and for a little short time or long time and create shunt too. That I'm not going to talk about this on this clip. Later I will prepare those common congenital heart disease for general information. Do you remember the how we can whistle? Just we pucker or we collect and make small our mouth, and we strongly push up, blow out the air, and we create a sound by mouth. The same situation happen in those murmur. For any reason, we can hear those sound or murmur by stethoscope very easy, and it looks like this one, that the doctor can hear, and based on the severity, usually the doctor grades mild, moderate, severe, that we are not going to talk about that. Just the doctor when he examine you, they can hear that a murmur easy. Now let's answer to this question. Does it important we have murmur? And should I concern? And what should I do? The answer for this is very simple and easy. Based on the finding the doctor on exam you and severity of that murmur and mechanism and cause of that most of the time the doctor can figure it out just with physical exam. But for making sure 100% and having a baseline result and information for follow-up if we need it, almost always the doctor uh, order echocardiography. Echocardiography or ultrasound of the heart is a medical very safe technology that we're using uh, machine and ultrasound sound beam that is at the level of the ultrasound. We create a real cross section of the heart in different angle. In that uh, study, we check it everything, structure, function of the heart at all level. And with the putting color here, you can see color, we can see any abnormal blood flow in any spot or not, the structure, function, measurement, is almost all every things that we need for the heart function and structure in echo can be found. So it's very safe and very good tools, and if the doctor recommend, 100% do it. It take about half hour ish, sometime a little more, sometime less. You don't need to prepare any specific unless there is a specific study. As you can see here, this is cross section of the heart in different plane. Depending on what plane you the tech put the marker and probe different maneuver, we can get different cross section of the heart. You can see those valve, how much thin they are, those chamber of the heart, chambers, left atrium, left ventricle, aortic valve, mitral valve, they opening and closing very well with the put color. The doctor, the tech can check all of them and measure any normal and abnormal finding, and finally the cardiologist read it and report to your doctor the all finding. Most of the time, if it's leaky valve, if it's mitral valve, most of the time is benign and innocent, is mild, trace to mild. But if it's more than that, then the doctor make a plan what is the cause of that and how to follow up. Depending of those finding, maybe every 6 months, every 1 year, or every 2 years, or just nothing, will be make schedule and planning for the future. So generally speaking, it doesn't need to be worry unless there is some serious, moderate to serious problem like tightening of the aortic valve or moderate to severe leaky valve. In those cases, the doctor make a correct plan for management and follow-up. Before you close it, I want to mention some important things. First of all, sorry, I know I have a strong accent. After a few clips you listen to me, you get used to it. I do my best, try to correct that, but that is what it is. Second, every week, this is the first one, but every week I try to prepare some clips. All of them depending on your feedback. If you need some specific topic, put on the comment. I read all the comments and I do my best prepare for those subject and topics or your question. And if you thought it is useful, it can relieve your stress and anxiety, and give me a favor, put the comment and share it. Up to the next time, have a wonderful time.